All right, this is part 2 of medication errors. So we were looking at what were some of the underlying causes of medication errors, and we were looking at problems with communication. The second is confusion between different drug products. So in this case, a person ends up getting the wrong drug. And one of the issues with that it underlies confusing different drugs is sometimes drugs have similar names, and they either look like they're spelled similarly, or and that could be either the generic name or the brand name. So for example, some common drugs that are often confused are ephedrine and epinephrine. And again, they look very similar. And in fact, they're the same types of drugs. They're both vasoconstrictor drugs, so they make blood vessels narrower to bring up blood pressure, but epinephrine is about 1,000 times more potent, and so if we give the wrong drug, then we could be really overdosing somebody. Lamictal and Lamisil look very similar. These are brand names. Lamictal is an anti-epileptic, and Lamisil is an antifungal, and so they're two totally different drugs. Taxol and Taxotere, that has been an error that has resulted in fatalities. Again, they are both chemotherapy type drugs, and yet they have the different potencies again. Seroquel and Serazone were confused, and that caused a fatality. Seroquel is an antipsychotic and Serazone is an antidepressant, and so again those were confused. And on the right you see this was an order, and this was an order for Metadate, and although the handwriting is sketchy, although you can read Metadate, it was confused with methadone, which is an opiate that's used for heroin withdrawal, and Metadate is a drug that's used to treat ADD, ADHD. So one thing to think about is what would you do as a DSW to try to prevent drug product confusion? And one thing certainly I think is our golden rule, which is to know your drug. So before you administer a drug, you should have looked up that drug and you know why that drug should be given. So that would help prevent some errors, like for example, somebody that has ADHD, and you're supposed to be giving the drug for ADHD, and yet so you would question, it should raise a red flag, why am I giving this person an opiate? And the same with, mistaking an anti-epileptic for an antifungal. Knowing what the drugs do, having looked them up, and knowing what the indication is, so why you're giving that drug to a particular person, would help reduce that type of error. So here's just a good example of how our brain functions. So if you look at this figure here, if I say alphabet, what do you think of? And if I say number, what do you see? So this is what we call confirmation bias. And confirmation bias is a type of selective thinking where our brain selects out what is familiar to us or what we expect to see, as opposed to what is actually there. And this is one of those problems when you look at drugs that are spelled very similarly. If we've seen one of those drugs before, our brain is automatically going to think that that's what the drug is, unless we're actually really paying attention to it. And our brain, as we've discussed, is really able to fill in gaps. So what I'd like you to do is I'd like you to read this out loud to yourself. Okay. So I think this is kind of crazy, but our brain does not look at every single letter in a word. In fact, our brain looks at the word as a whole. So now you can see why ephedrine and epinephrine, which both start and end with the same letters, could be easily confused if we are just glancing over it. So we have to actually make our brain look at every letter so that we make sure that we've got the right drug. Here are some of the things that are being done to help reduce some drug confusion, and one of them is called Tallman lettering, or mixed case lettering, and you may have seen this, and in fact we should be using this in our MAR assignment, and I will give extra marks for those people that look up drugs that should have Tallman lettering and use them in their MAR assignments. So this is where we spell a word using both capital and small cased letters, and it helps draw attention to parts of the drug that are dissimilar, that are different from a drug that it may be confused with. And so this Tallman lettering is used on the labels, on medication orders, and it should be used in documentation as well. And there's a list of recommended drugs that should have Tallman lettering, and it's posted on Blackboard in your pharmacology resources. And again, I won't take marks off if you don't use it, but I will give you extra marks if you do use the correct Tallman. And it has to be the correct Tallman lettering. You can't just make that up. But if you use the Tallman lettering. Another cause other than confusing different drugs may be problems with the labeling themselves. And so if you take a look at this top, these are all respiratory drugs, and they are all in these clear packages with the labeling imprinted in them. And so it's very difficult to see. And so what's happened in the past, particularly in hospitals, is people have grabbed the wrong drug. Or if the labels look similarly. So if you look at the bottom right-hand side, vercuronium bromide is a neuromuscular paralyzing agent. So it's given if you're under anesthetic, and it paralyzes your breathing so you don't fight the ventilator. Of course, if you get that when you're not supposed to, and you're not on a ventilator, then that could be a very serious medication error. So the ISMP recognizes when errors have been made because of packaging, and so they make recommendations to industry to make their packaging different, and this helps avoid drug confusion. So, right away, if you recognize a particular packaging as a particular drug, then that will help you from, help prevent you from picking, a similar looking package. Okay, star. This is a huge one, and especially for DSWs, and this is one of the biggest contributors to med errors that occur, in the community. And this are distractions and interruptions when you are administering medications. And so, a good example is a DSW that is preparing to administer medications, and they start the process and the phone rings, and and they're the only one on staff to answer the phone. They leave, they come back, they have forgotten where they've left off, and a med error occurs. So it's very important that the medication administration area in the environment is a place that is quiet. It is off the beaten path, so that there's not this flow of activity that goes by it. There's no radio there or things that people could be listening to while they're doing the job. And that when somebody has said, I'm going to administer medications, that it's been arranged that somebody else is going to take care of all of the other stuff that may be happening at that time. Any crises that come up, if somebody comes to the door, the phone rings, or all of those things. So the person that's going to administer the medications should be able to focus specifically on that job and in a nice quiet environment. The environment should also, so sometimes, for example, people put the medication administration area in the kitchen, which is a really bad area to put it in. Or on top of the washer dryer, it's another bad area to put it in. On top of that, when a person is going to administer medications, they need to be totally organized and have all their materials that they need right at the very beginning, and and have that all set up, ready to go, so they don't have to leave for any reason to go get something. Again, another distraction. Sometimes distractions can be caused by staff that are stressed or staff that are fatigued, and it's usually the result of being understaffed. And again, that has shown to contribute to medication errors as well. So I think that even things like not only noise and interruptions, but things like poor lighting, things like an environment that's too hot or too cold. So again, you want to have an environment that is as distraction-free and as you can. So this allows an individual to to focus on what they're doing and to make sure at every step that they're following every single step. So that's a really huge one. That's one that's a problem, I think, for DSWs, and that's one that we have to work on, and it's one that you could work on when you are working in the field to make sure that you have a safe medication administration area, so where the drugs are kept and where you're going to actually prepare, drugs and how you're going to administer them. Another big cause for medication errors is if there is incomplete client information. So for example, things like allergies or other medications that a person is taking or their medical history. And this can often happen when a person sees more than one physician. And not all the information gets transferred from one physician to another. So two different physicians might prescribe two different medications and may not know that the other physician has prescribed a particular medication. Or a person develops an allergy to a medication and that doesn't get communicated again to another specialist that they receive. So again, you think about your responsibility as a DSW and that you are the link to be able to communicate that information. One really good technique is something we call brown bagging it, which means that when you go to an appointment with any physician, you take all the medications, and that's over-the-counter medications as well as prescription medications. You put them all in a brown bag, and you take that right with you to the appointment, and then you've got them all there, and that includes vitamins or natural products, everything. And then that physician can take a look at that, and then they can be aware of interactions that may occur. The other thing is that people should have their medical history with them on file. So again, when you go to an appointment, you can just take that medical history with them. And again, it gets communicated between different physicians. Sometimes people don't have up-to-date drug information. So for example, a new warning that has come out. So new special precautions, an individual shouldn't be taking this drug if. So again, knowing where you can get information about drug warnings, and so where would you go to find out what's the latest information? And I mean, the Health Canada website for sure. The ECPS is pretty up to date. Physicians and pharmacists maybe. I would say that pharmacists more often than physicians will have that up-to-date information, but the most accurate information will be just collecting it yourself right from the ECPS. And you all know how to use that. This is an example of a Health Canada website. It's called the Canada Vigilance Adverse Reaction Database. So you can either look up a particular drug to see if there have been adverse reactions or side effects that have occurred to that drug, or you can also report if a person has an adverse effect to a particular medication, and it collects that data. And again, there is a spot where it will list advisories and recalls, and again, you can get those also. The ECPS updates its site pretty regularly about new advisories for drugs or drug recalls. And again, there's links posted in your pharmacology resources on Blackboard. The last big category of causes, underlying causes for medication errors, is non-compliance. And this often occurs not so much if DSWs are administering medication to somebody, but if somebody's taking their own medications. And this often happens with seniors who may be taking many different medications. So polypharmacy is the term that we use for that. And if they're taking lots of different medications and they've all got separate instructions, sometimes it's hard to keep track of what medications they take when and how. For seniors, there can be a number of factors. It could be cost, so some seniors don't even fill their prescriptions, or they keep old prescriptions and use them, or they share medications. And as a result, they may be using out-of-date medications or the wrong medication. They may skip doses, to make a medication last longer. So those are some of the common reasons for non-compliance. Sometimes it's as simple as the jar that won't open, and because they have arthritis and they can't get those child safety caps off, or it might be even that they can't read the instructions because of eyesight issues. So for seniors and for people that that you may be supporting in a semi-independent living environment that are actually administering their own medications, being able to spot reasons why they're not taking them properly is really important. So, can you find a way that a container that a person could open, or can you find a way to help them keep track of what medications they're supposed to take when? Are there reminders? Are there things that you can be creative and allow a person to be independent but still taking their medications as they're supposed to be taken? And there's lots of different ideas for that, and you're going to be doing a little bit more of that in second year. Okay, this is the end of part 2, and we'll come back with part 3.